Patient LA is a 29-year-old male that came into the office complaining of a heavy sensation that he had in his scrotum. Upon examination, we did discover that he had a lump on his right testicle that was small but distinct in size. He reported that he had a vasectomy about 5 years prior to this visit. A family history was not able to be obtained due to the fact that the patient was adopted at a young age. He did, however, report that he smokes about a half a pack of cigarettes a day for the past 8 years, but did quit about 5 months prior to this visit. He stated that he has used cocaine several times in the past year, but he did deny any alcohol or IV drug substance abuse. The only medication that he is currently taking is albuterol, which is prescribed as needed by inhalation. This medication acts on the muscles of the airway to relieve the bronchospasms by relaxation, which improves breathing. The patient currently denies all clinical manifestations that are related to metastasis. Some of these manifestations that were denied include fatigue, dizziness, coughing up blood, chest or abdominal pain, or difficulty breathing. He does present with the risk factor being a 29-year-old male, whereas normal testicular cancer is discovered at patients about 15 to 35 years of age. All other assessments of the systems were determined to be normal findings. We did draw some blood, however, and a couple of lab tests came back abnormal. The platelet count was at 41,000, whereas normal range usually is 150 to 450,000. The ASP was also normal or abnormal at 71, as a normal result would be 0 to 15. The ASP is the alpha-fetoprotein lab test, which is an indication of tumors. These tumors normally present in the liver, testes, or ovaries. When this level is elevated, that means the cancer cells are present. After treatment, the levels should decrease and remain fairly close to normal, or at least decrease from the elevated levels that they were. If they again elevate, this is a sign that the cancer cells, as I said, are present, and this would indicate a relapse. The patient's renal function was normal as determined by the BUN and creatinine levels. An ultrasound was performed on the patient, and it revealed a 2-centimeter solid mass that was non-cystic in nature on the right testicle. An orchiectomy was then performed, followed by analysis of the cells that were obtained, and this further confirmed that the malignant cells were found only in the testicle and did not appear in the tunica albuginea, the epididymis, or the spermatic cord. The orchiectomy is a procedure of simply removing the testicles, and the testicles are the only thing that are removed. The penis and the scrotum, which is the pouch that holds the testicles, are left intact. This procedure stops most of the production of testosterone that naturally is produced in the body and that the cancer cells need to grow and multiply. After an orchiectomy is done, either as outpatient or as a short stay, full recovery is normally within about 2 to 4 weeks post-operative. The diagnosis of mixed cell tumor was then made on this patient after the procedure, and the orchiectomy should be the only treatment that the patient needs, unless with follow-up visits there is signs of metastasis discovered. This concludes case 74 on 29-year-old male LA. Thank you.